The pharmacy department at Salina Regional Health Center is happy to provide a monthly diabetes support group the third Tuesday of every month at 6:30 p.m. My name is Cameron Atwill, and I am a clinical pharmacist at Salina Regional Health Center.
Well, Cameron, thank you so much for joining me today. We're going to be talking about diabetes and diabetes support group you're doing. Let's start out talking about how many people are affected and who is affected with diabetes.
Yeah, thanks for having me. So last year, the American Diabetes Association put out their new numbers, and unfortunately, kind of getting worse. So right now, we have about 100 million Americans with prediabetes, so you think that's almost 1 in 3. Whereas those with the actual diagnosis of diabetes, it's closer to about 1 in 8. Diabetes is currently one of the most expensive health conditions a person can have. It is one of the leading cases of Medicare spending. So when we think of the numbers, like everyone probably knows somebody with diabetes or they are personally impacted by it.
Okay, which brings us to what we were going to talk about, which is the diabetes support group. Why don't you talk about that?
Yes, it is a program that's been run by our pharmacy department for several years now. We have it every third Tuesday of the month at 6:30 at the hospital. We have several different specialties who come and present every month. We have physicians, the dietitians, exercise physiologists, and several of our pharmacists as well.
Let's talk about some of the issues that people with diabetes have, and you can kind of talk about actually working that into the diabetic support group, because I think you have people talk about those as well, right?
Yeah, we get a lot of questions because diabetes is a very difficult disease. So it is the leading cause of kidney disease and eye disease in America. We get lots of questions about like wound care, especially foot care. In the past, we've had our podiatrists come out and give really good presentations on that. Or things as simple as what is a safe sugar to eat, or what kind of sweeteners can we use for cooking.
So the dietitians will actually take them through some meal plans as well, probably?
Oh yeah, and there are some wonderful recipes. We do have some nice treats that are brought in by the cafeteria that are diabetes friendly and are delicious.
If someone's interested in going, what do they need to do?
Just show up. It is completely free, open to the public. Once again, it's the third Tuesday of every month at 6:30, and we'll be more than happy to have you. Our presenter tomorrow is going to be Kaylee Knox, who's with Salina Endocrinology, and she's going to be talking about glucose monitors.
Well, Cameron, thank you so much for coming on the show, and thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter and Instagram. Or if you would like, come to the Diabetic Support Group the third Tuesday of the month at Salina Regional Health Center.